Welcome to the Week 3 lecture. This week we are doing the first two body systems, first starting more superficially with the integumentary system, then deeper with the muscular and skeletal systems. Let's get started. Here are the objectives for this chapter. These are the same objectives you'll have in Connect. As I said, the integumentary system is more than just the skin. It includes hair follicles, exocrine glands, fat, blood vessels, nerves, hair shafts, and fingernails too. The most superficial layer of this system is the epidermis. Let's break down this word to its prefix epi and the combined term dermis. Epi means on or above or before, while dermis refers to the skin. This is above the skin or before the skin is what it literally means. After the epidermis is the basement membrane, not showed well here, and then the dermis, which has most of the structures of the skin, including nerve endings, hair follicles, sebaceous or oil-producing glands, and sweat glands. The area labeled fat layer is the hypodermis or subdermal layer and is not part of the skin but divides the skin from the muscles below. It contains the larger blood vessels, nerves, along with the body's main fat storage. Now onward to your vocabulary terms. Audio or adio means fatty, like our lion friend here. But so does steato and lipo. You see our first examples here, but there are other examples like lipid, liposuction, adipose. Cutano, dermato, and dermo all mean skin, like in dermatitis, as we add the suffix itis to make inflammation of the skin, or dermatitis. Hydro means sweat, and ichthyo means scaly, like a fish. Kerato means horny tissue, like this horny toad. Example is keratosis. Both pilo and tricho mean hair. Again, there can be multiple combining forms with the same meaning, so be aware. Myco means fungus, like in mycosis. Onycho means nail, but not these types of nail. This type of nail, like in a fingernail. Melano means black or very dark. Say, where did the lights go? Xantho means yellow, while xero means dry, like this desert. Let's look at some more anatomy. The epidermis is actually made of several layers, with the stratum basale as the deepest and the stratum corneum as the most superficial. In the dermis, sebaceous glands are always associated with hair follicles and make sebum or oil for the hair. Erector pili muscles are what causes the goosebumps when you are cold or scared. The hair follicle is alive, while the hair shaft is not. The melanocyte here gives the hair its darker color. The lunula is the half-moon shape at the nail base and still contains living cells, but they become keratinized and are non-living from here. The cuticle is the skin against the nail bed. Macules are flat and most distinct in color, like these age spots or solar spots on the dorsum of the hand. A papule is raised and solid and usually small, as they are less than 1 centimeter in diameter. A nodule is much bigger, raised in solid mass greater than 1 centimeter. These can be benign or malignant and similar to a tumor. A polyp is another solid growth, but usually has a small stalk that it projects from and can be found on any body surface, including the inside of the large bowel. A tumor is a large growth made up of cells. It can be benign or malignant. This means it can just be a simple growth that is not cancerous or could spread through the body, or it can be malignant, where it does spread into the rest of the body. This is a basal cell skin cancer, which is very common. A bulla is a large blister. It has a thin layer filled with fluid. It must be larger than 1/2 centimeter. The plural form is bulli. A smaller blister is a vesicle less than half a centimeter. A cyst is also a filled mass, but is much deeper and has a thicker surrounding layer. It can be filled with fluid, air, fat, and other substances. If it's filled with fat, it's called lipoma. Rubeola is measles, and rubella is German measles. Look at all those red spots. Roseola, also known as Syck's disease, is a red rash on infant faces and is harmless in general. Tinea is a fungal skin infection, and the red leading edge is what gives it its name, ringworm, while the inside is not infected. It is named by where it is located on the patient, like Tinea capitis if on the scalp, Tinea pedis if on the feet, and Tinea corporis is on the body. Eczema is a very itchy red rash, usually due to allergic reactions. Pruritus means itchy. Petechiae are small, tiny bruises, usually seen in fevers or platelet disorders. Purpura are larger bruises, like what most of us get when we bump our legs or arms on tables or something. Ecchymosis is a common large bruise, very, very large. It may come from trauma or could be from another underlying health issue like a coagulopathy. Hair follicles can become infected with bacteria causing folliculitis, and if left untreated, it can become a furuncle, and this can be developed into a carbuncle and multiple furuncles at once. The redness on the surface of an infection with bacteria in the skin is called cellulitis. Herpes simplex virus causes cold sores, and the type depends on where they're at. Type 1 is around the mouth, type 2 near the genitals. Varicella Zoster is a virus of the herpes family that causes chickenpox the first time you get them as a child or an adult, but they will always be with you like a good friend unless you get the vaccine first. Varicella Zoster is also seen in adults. It can recur as shingles. They stay in one dermatome of the body. Warts also come from viruses, not frogs as many may think. The degree of a burn depends on how deep into the skin it involves. First degree is very superficial. We all have these. Second degree is deeper, involving the dermis and take a bit longer to heal. Most have had at least one of these in their lifetime. Third degree is most rare and is where all the layers of skin are destroyed to the hypodermis or even the muscles. This usually requires a skin graft. Acne is something we have all experienced, and this is where the sweat glands and pores become infected with bacteria. If there are dead skin cells at the surface, then this is called a blackhead or a comedo. If the hair follicle becomes involved, then it will turn into folliculitis. But if it stays at the pore or hair shaft, then we will just have acne. If it fills with pus, then we will see a pustule. A corn is a hyperplastic area that is keratinized on the toes, but a callus is located on the foot proper and usually much larger. These all come from the skin being rubbed by shoes constantly. The skin will keratinize or thicken in response with continued stress. Now on to the muscular system. Here are the objectives, similar to the ones in Connect. The skeletal system is essential for support of our body. It makes blood for us and stores calcium and phosphorus, which we need for muscle nerve conduction. The muscular system attaches to the skeletal system to make movement possible, along with help from our nervous system. Let's do some more vocabulary, as this is why we're here. Ankylo means bent or crooked like these trees. Arthro refers to our joints. Brachio means arm. Bursa refers to the bursa, which are extensions of synovial joints. Synovial joints are the major joints of the body and contain synovial fluid, and the bursa does too. Calcaneo means heel. Calcio means calcium, like what is in milk. Carpo means wrist. Cephalo means head, while cervico means neck. This giraffe must be really tall. Chondro refers to cartilage and osteo refers to bones. If we take the word osteo, which means bones, and then add arthur, which means joint, and then add the suffix itis, then we get osteoarthritis, which is bone joint inflammation, or the most common type of arthritis with destruction of the cartilage. Condylo means knob or knuckle. Cranial refers to the skull. Let's look at this skull for a second. Note the suture divide the flat bones of the cranium. See the suture between parietal bone and the occipital bone. You will get to know the skull very well in the AP1. Vertebra refers to vertebra. Brachio refers to the spine, and costo refers to the ribs. Thoraco refers to the thorax, like the thoracic cavity we learned last week. Sterno refers to the sternum. Look at the ribs and see some of them attached directly to the sternum. These are the true ribs, while some indirectly attach to another rib, and these are false ribs because they don't directly attach themselves. And then there are some ribs that do not attach at all to the sternum. They look like they're just floating out in space. These are the floating ribs. Scapula refers to the scapula or shoulder. Humero refers to the humerus, which is the funny bone. Radio refers to the radius. Ulno refers to the ulna. Carpo refers to the wrist. Metacarpal refers to the hand or metacarpals. Phalanges refers to the fingers or toes. Ischia refers to the ischium. Femoral refers to the femur. Patella refers to the patella, which is a sesamoid bone. Tibia refers to the tibia. And pedi or pedo refers to the foot. Wow, there are a total of 206 bones in the body, although some may have more or less due to anatomical variation, but most have 206 bones. We have long bones, like the femur, short bones, like this vertebra, flat, like the parietal bone, irregular, like this rib, and then sesamoid, like the patella. Sesamoid bones are far away from other bones. The spine divides up into the cervical, thoracic, lumbar, sacrum, and coccyx. Here are the three types of muscles. First, we have skeletal muscle, which is voluntary, striated, which means it has stripes. They're the muscles that you move around with. Cardiac is our heart muscle. It is involuntary, and like skeletal muscle, it is also striated. The third and last is smooth muscle, which is located in our digestive system. It is also involuntary, like cardiac, but not striated, as it is smooth. It also helps you move, if you know what I mean. Let's look at some of the muscle movements. For example, adduction or adduction is moving the arm or leg down from an upward position, while abduction or abduction is moving the arm or leg up from a downward position. Think of that extra D in adduction as down to help you remember that adduction or adduction is moving down toward the body, and then abduction is just the opposite. Supination is turning the hand at the wrist so the palm is up, and the opposite is true of pronation. To remember if a patient is supine in a body position, remember the saying, if a patient is supine, then they're laying on their spine. Dorsiflexion is the foot pointing up, and plantar flexion is the opposite. You can also think of dorsiflexion as decreasing the angle of the ankle joint, and plantar flexion is increasing that angle. Radiographs are also known as x-rays. We have all had an x-ray at one time or another. They let us see live bone in the body using x-ray radiation to penetrate the body and record an image on a blank piece of film. The white areas are bones, and the calcium in the bone will stop the x-rays. Metal pieces shown here also are visible, as they also stop the x-rays. Arthrography is using a fluoroscope, which is a continuous x-ray, to do things like joint injections, as shown here. You can also do arthroscopy, which is a surgical procedure using a small camera. Electromyogram measures muscle strength and waveform. This can test for diseases that may affect your muscle strength, like, for example, myasthenia gravis. Bone scans can look for cancer metastasis in bone, as shown here, or infection, like osteomyelitis. Spinabifid is a birth defect in the spinal cord causing spinal fluid-filled mass at the base of the spine. This can be surgically corrected. Rickets is vitamin D deficiency in children and also can be corrected. See the bowing of the legs here. Osteoporosis, the lack of vitamin D and calcium in older people, causing the density of their bones to decrease. Please note the kyphosis in this person with osteoporosis. Scoliosis is where the spine deviates sharply to one side. This can cause a hunchback appearance, but can be corrected by braces or surgery. Thank you for viewing. We are now at the end.